premature twins, a case report. Introduction. The pandemic of the new coronavirus SARS-CoV-2 discovered in China in December 2019 marked the history of epidemic experienced by humanity. The newborn is susceptible since this virus spread to people of all ages. Through the study of these cases, we will show the impact of COVID-19 infection in preterm twins. We report the case of two preterm twins of different sexes born at 32 weeks of amenorrhea and whose mother was infected by COVID-19 2 days before the cesarean extraction due to the presence of a retroplacental hematoma. The first case is about a preterm female with a birth weight of 1,400 grams and an Apgar score of 8, was admitted at the first hour of life for respiratory distress at 3 according to the Silverman score. PCR COVID-19 at 24 hours of life was negative. The radiography and biological assessment were normal. The figure 1 showed the X-ray pulmonary chest of initial one who returned normal. The newborn was initially isolated, put on CPAP and intravenous antibiotic treatment with ceftriaxone amoxicillin for 5 days and gentamicin for three days. A control was performed on the 12th day of life, which was positive. The newborn was put on azithromycin for 5 days with a good evolution. He became apneic, apyretic, tonic, and reactive newborn with an output weight of 1,700, as the picture shows below. The second case is about a preterm male. It's about a preterm male with a birth weight of 1,600 grams and an Apgar score of 7, was admitted in the first hour of life for respiratory distress. 4, according to the Silverman score, PCR COVID-19 at 24 hours of life was negative. The initial chest X-ray showed the thoracic distension with the horizontalization of the ribs. The preliminary biological tests were normal. This is the first X-ray chest pulmonary of the preterm child who showed the signs of distress. The newborn was initially isolated, put on CPAP and intravenous antibiotic therapy based on ceftriaxone amoxicillin for 5 days and gentamicin 3 days. On the 12th day of life, respiratory distress worsened and the fever appeared. The chest X-ray showed the bilateral infiltrate of the 2 upper lobes and right basal area suggestive of COVID-19 involvement, which was confirmed by PCR. The figure 4 showed the 2 upper opacity on the pulmonary parenchyma and the basal one. The biological workup showed thrombocytosis of 71,000, CRP of 27, procalcitonin of 0.63 nanogram, fibrinogen of 6 gram, and DDMAR of 600. Cardiac echocardiography showed pulmonary arterial hypertension. The newborn received an hemoglobin infusion, azithromycin, solumedrol, and inhalated sildenafil and nitric oxide for his pulmonary arterial hypertension. He was then intubated and died on day 20 of life. As a discussion, SARS-CoV-2 is a zoonotic single-stranded RNA virus of the beta coronavirus, along with SARS-CoV and MERS-CoV that belong to the Coronaviridae family. Its transmission in newborn is most often horizontal, either by direct inhalation of viral particles contained in the cough aerosol or by contamination from the environment of an infected person. Vertical transmission is less common, while transmission through the mother milk has not been demonstrated. Breastfeeding is not contraindicated in the case of COVID-19 infection in the mother or newborn. A large Chinese cohort of mothers infected with SARS-CoV-2 in Wuhan revealed a 21% increase in prematurity compared to national averages, with the COVID-19 infection accounting for half of the increase. In our cases, prematurity was caused not only by the mother's SARS-CoV-2 infection, but also by the presence of the retroplacental hematoma. Treatment of COVID-19 infection in newborn depends on the clinical presentation. In asymptomatic case, no therapy is usually required, whereas supportive care and paracetamol are advised in mild to moderate cases. Intravenous immunoglobulin therapy may be used in cases of COVID-19 related to multi-system inflammation. In our study, SARS-CoV-2 damage was mild in the first case and severe in the second, necessitating reanimation measure, antibiotherapy, and respiratory support. The mode of maternal-fetal transmission of SARS-CoV-2 is not well understood. However, it has been revealed that vertical transmission of COVID-19 from mother to fetus was mediated via receptor of angiotensin-converting enzyme 2. The viral spike protein binds to the cellular receptor, allowing SARS-CoV-2 to enter the cell. The angiotensin-converting enzyme 2 gene is expressed in the endometrium as well as stroma, male cells, and syncytial trophoblasts. A very low level of angiotensin-converting enzyme 2 expression was found in the trophoblast during the first trimester of pregnancy. Its expression rises constantly during the pregnancy trimester and is more capable to transmit the virus through the placenta to the fetus during the last trimester of gestation. This suggests that placental transmission of the virus is possible, especially in the last week of pregnancy. In the case of our preterm, the vertical transmission of SARS-CoV-2 is probable since the mother was infected with SARS-CoV-2 2 days before delivery without any skin-to-skin contact. The preventive measures were respected by the care team, and the COVID-19 PCR test was positive. However, no placental sampling was performed. The SARS-CoV-2 virus infection is generally harmless, but it's more severe in a pregnant woman, causing severe respiratory distress that can lead to death, highlighting the importance of vaccinating pregnant women against the virus. In conclusion, despite the fact that epidemiological data on SARS-CoV-2 infection in newborn are encouraging, there are some severe cases that require special attention. The best treatment is prevention through the use of barrier measure and vaccination of pregnant women. Thank you for watching.
Thank you, Ghita. Thank you for sharing us your research work.